Hello, class. In this session, we're going to be talking about addictive behavior. That is chapter 13 of the course textbook. Let's begin. Learning objectives. By the end of this chapter, you should be able to analyze the detrimental effects of addictive substances, including caffeine, prescription drugs, inhalants, marijuana, cocaine, methamphetamines, MDMA, heroin, new psychoaddictive substances, and alcohol. List the detrimental health effects of tobacco use. Identify cigarette smoking as the largest preventable cause of premature illness and death in the country. Enumerate the reasons people smoke and explain the benefits and the significance of a smoking cessation program. What is addiction? Addiction is a chronic brain disorder that leads to compulsive behavior despite harmful consequences. It alters the person's brain structure, affecting reward, motivation, and memory system. Addiction is described as a problem of imbalance or unease within the body and mind. Almost anything can be addicting, some more detrimental than others. Most serious forms of addiction are chemical dependency on drugs. Others include food, work, caffeine, gambling, pornography, and even exercise. Behavioral addictions. Behavioral addictions are patterns of repetitive, compulsive, and excessive engagement in a rewarding activity that leads to significant negative consequences in various aspects of life, such as gambling, internet and social media addiction, shopping addiction, gaming, food, sex, and pornography. There's many signs and symptoms of behavioral addiction: intense desire despite negative consequences, preoccupation with frequent thoughts, needing more for the same effect, neglecting responsibilities, continue despite negative outcomes, sometimes even involving financial, legal, or relationship problems, withdrawal symptoms like irritability or anxiety, loss of control and inability to stop or even sleep, excessive time and money spent, inappropriate coping mechanisms for stress, and engaging in risky behaviors. There is also substance addiction, and these are the ones we're going to spend most of our focus on this session. Substance addiction is a disorder that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medicine. And there is various substance addictions: alcohol, opioid, stimulant, cannabis, sedative and tranquilizers, hallucinogens, and inhalants. And again, there is various stages in addiction: the initiation, the person trying the substance for the first time; the experimentation, now it starts to occur more regularly, then it becomes a regular user, that person starts engaging in risky behaviors, then dependency, and that dependency is what leads to the addiction. The drug creates an addictive or dependency effect on your body, and that's the hook of the drug. The drug makes you experience a state of feelings that your body goes through that affects the brain's ability to respond, creating a dependency on the drug because your body wants to experience the same effects over and over again, and that's what creates the addiction. And many addictions are very difficult to stop. The best way to prevent addiction is to not use drugs in the first place. How does addiction develops? There's many factors that predispose people to addiction. The first is when the behavior is reinforced. That is when the person is using a drug for the first time and other people are reinforcing that behavior, means that other people are using the drug with the person. So the person is not being told don't do it. In fact, the person is being reinforced to keep doing it because others are doing it with him or her. There's an attempt to meet basic human needs. Sometimes people get into drug addictions because they're going through serious emotional issues like depression or anxiety, or they have experienced a major traumatic event in their lives. And those events may trigger the person seeking a way to meet basic human needs. And then they get exposed to drugs as a way to cope with their reality, as a way to release stress, to relieve negative thoughts, but temporarily. Sometimes they may even engage in drug use because of peer pressure, trying to be accepted by others, or because of serious physical illnesses, like those who become dependent on painkillers. They're not hooked to painkillers because of social acceptance, it's because the body is going through chronic pain and they're using the drug to take the pain away. Okay, there's also pressure to perform or succeed that also can put somebody at risk for the use of drugs. There is also genetic link. There's some people who have found evidence that sometimes there is predisposition for certain type of drugs because of family history. Drug misuse and abuse. Illicit drugs are still the highest in terms of drug usage in the country, followed by the use of marijuana, weed. Then that's followed by non-medical use of psychotherapeutics, many times painkillers, those things that take pain away. Okay, but by far, illicit drugs and marijuana are still at the top of the drug list of users. Drug refers to any substance that alters a person's ability to function. And these can be over the counter medications, prescription medications, or illegal substances. Any drug can be misused and abused, may lead to physical and psychological dependence. When drugs integrate into a person's body chemistry, the person's tolerance increases. And that's why many times they start with some simple drugs but eventually move to harder drugs because they have become tolerant to the effects. Caffeine. Caffeine is perhaps the most widely consumed psychoactive drug. And you may wonder, caffeine a drug? Well, yes. Now, you might find caffeine freely in coffee. You can also find caffeine freely in tea. But you can also find caffeine synthetic. And that is the type of caffeine that often you find in energy drinks. Most of the times advertised as energy boosters. And they're added to a variety of foods and beverages. Up to 400 milligrams of caffeine per day is considered safe for most. However, energy drinks lack regulation, association with drug and alcohol and cigarette use, and the sad part and the most serious issue is when these energy drinks are being used in combination with alcohol because they increase the risk for heart attacks. Your body on energy drinks. Here is a list of all the negative consequences that occur in your body when you consume energy drinks, such as Red Bull, Monster, etc. Be very cautious when you're using these type of drinks to keep you alert or on a daily basis because You may experience unwanted negative side effects by its consumption. Non-medical prescription drug use. The drug problem in the United States is not limited to illicit drugs. Misuse of non-medical prescription drug is a growing problem. And probably many of you have heard about the opioid epidemic in the country. The addiction to painkillers. Some of the non-medical prescription drug that's being currently misused or abused in the country are opioids like codeine and morphine, central nervous system depressants used to treat anxiety and sleep disorders, or stimulants to treat the sleep disorder, narcolepsy, ADHD, and obesity. People who abuse these drugs may think these drugs are safer than illicit drugs. However, they have detrimental effects on the body, specifically your liver. Your liver can be damaged seriously, severely by the misuse of these type of drugs. Use of other drugs. Marijuana, weed, very commonly used. Illegal drugs like cocaine, methamphetamines, MDMA, heroin, and other type of synthetic drugs or cannabinoids. They have all part of the list of drugs available, misuse and abuse, all having negative consequences on the individual's overall health. Alcohol. Alcohol is a depressant drug that affects the brain and slows down central nervous system activity. Affects sense perception, motor skills, judgment, and self-control. Dangerous synergistic effects when combined with other drugs, particularly central nervous system depressants. That's why many times when you're taking antidepressants, you are told do not use alcohol when taking the medication. There is many long-term risks of alcohol abuse, in specific developing cancer, destroying your liver, damaging your kidneys, and affecting your brain. Alcohol, when used in high amounts, alcohol when abused, or alcohol when in addiction, can have serious detrimental effects on your body's health. What is alcoholism? It's a disease in which an individual loses control over drinking alcoholic beverages, has both a genetic and an environmental component, and it develops slowly. How to go down on drinking? First, you need to recognize that a problem exists. The person has to want to cut down. They have to set reasonable limits and learn to say no. They need to drink slowly. If possible, dilute your drinks with water. Do not drink on your own. Or try a smartphone app to help you control your drinking. Tobacco. Tobacco smoke contains tar and nicotine, which is the substance that hooks the person, that creates the addiction, and over 7,000 other toxic chemicals. About 70 of those proven to be carcinogens, meaning leading or causing types of cancers. There's different types of tobacco: pipes and cigars, smokeless tobacco, and cigarettes. There are many negative health effects of tobacco. And if you remember our conversation on preventable death and risk factors, tobacco use is one of the leading causes for cancer. Therefore, if you quit or stop using tobacco, you will reduce your risk for developing cancer. Why is smoking addictive? Because it has chemicals that create addiction, in specific, nicotine. A stimulating effect of nicotine produces strong physiological and psychological dependency. Smoking only 3 packs of cigarettes can lead to physiological addiction and dependency. Physical addiction to nicotine is 6 to 8 times more powerful than alcohol addiction. Physiological and psychological dependency develops over a longer time. There are 7 steps for quitting. Step 1. Decide positively that you want to quit. You need to realize that there is a problem. Just like any problem behavior, the first step is to realize that there is a problem and something needs to be done to change it. Step 2. Initiate a personal diet and exercise program. Change the problem behavior with another better behavior. 3. Decide on approach to stop smoking. 4. Keep a daily log of your smoking habit. You will not be able to quit right away, but you want to slow the amount of smoking per day. Step 5, set a target date for quitting. Step 6, stock up on low-calorie foods and drink water. And step 7, avoid cigarettes and triggers. Replace smoking with a positive substance. Sometimes people have found the use of gum as a great way to reduce the amount of stress for which they smoke in the first place. Nicotine substitution products. There are different types of nicotine substitution products to help the person stop smoking, but still being able to get the needed nicotine for which they got addicted in the first place. Patches or gum, electronic cigarettes. The most effective way is physician supervised program. It's just finding something that works for you. However, most of you have seen young people using e-cigarettes or vapes to substitute for the use of a cigarette. But these vapes also have significant negative consequences because of the chemicals that are being used to create the substance. So it's not only that you're receiving or getting the nicotine that's getting you addicted, but the chemicals that have or are found in these e-cigarettes or vapes are just as harmful as if we were smoking the cigarette in the first place. Life after quitting. Well, for the first few days, the person can expect a series of withdrawal symptoms for a few days. Physiological addiction to nicotine is broken 3 days after your last cigarette. Long-term psychological dependency may be more difficult to break. However, think about the benefits. Think of yourself as a non-smoker and seek assistance of a mental health expert or consultant or counselor to help you in your journey. In summary, addictions are marked by incessant and uncontrollable dependence on a particular behavior of substance despite continual negative physical and emotional consequences. The most serious form of addiction is a chemical dependency on illicit and prescription drugs, tobacco, and alcohol, but almost anything can be addicting. Drugs misuse encompasses the intentional and inappropriate use of over-the-counter drugs, prescription medications, and illegal substances. Caffeine is the most widely consumed psychoaddictive drug. Abuse of prescription drugs is a rapidly expanding problem in the United States. Alcohol is the most abused substance in the United States and the cause of one of the most significant health-related drug problems. Tobacco use in all its forms is considered a significant threat to a person's life. Up to half of tobacco users will die from its use. Smoking only 3 packs of cigarettes can lead to physiological addiction and a tolerance to nicotine and tobacco smoke. A person's desire to quit is the most important factor in quitting successfully. Nicotine substitution products are thought to be most effective when used in a physician or medical supervised cessation program.